Let's talk baby teeth, also called primary teeth. So, I've been a dental hygienist, a dental professional for about 23 years now. And it's a very common question for people to ask me, what's the point of fixing a cavity in my kids' teeth if the teeth are going to fall out anyway? They're just the baby teeth, the baby tooth. Or what if I say, there's no point fixing this one because it's going to fall out soon? And kind of how does all of that work and why? So, in general, it does depend on when that tooth is expected to fall out. That tooth might be expected to fall out at 5 years of age. That tooth might be expected to fall out at 10 years of age. You get the idea. So it really does depend. As an example, if I see a cavity in a 2 year old, that baby tooth isn't going to fall out until they're at least 5 years old. So they have to sit there with that cavity eating away through their tooth, potentially damaging the nerve and causing pain for that amount of time for 3 years. I don't think that's a very good idea. This is when we would fix things. But the good news is you don't always have to go right on in there to perform a filling. If the child is 2 years old, and let's just say it's a very small cavity, there's something called silver diamine fluoride. It's a little drop that you can actually put a drop on that cavity to kill the cavity. It doesn't change its look, it doesn't change its shape, it doesn't make it look any better like a white filling would. When we do a filling, we actually remove the cavity and then patch it up, if you will, with the white filling. So it looks like a tooth again and it looks normal. But the silver diamine fluoride is just a liquid, so it doesn't change the look. It's going to look exactly the same, but it takes zero point 0.2 seconds. It's very, very fast and it kills the cavity. So the cavity doesn't get worse. And that can be a great option, especially for a 2 year old who can't sit there to get a filling done. You try telling a 2 year old to sit there calmly while we're giving them a needle, we're taking out the high speed handpiece, we're patching it up with a filling. These things take time. The other option would be to put that 2 year old to sleep to fix that cavity. That is an option, but it's going to cost more to put the child to sleep under general anesthetic, thousands of dollars, than it would be to fix the tooth with a filling, but you can't do that unless you've put the child to sleep. So that's where silver diamine fluoride is a really good option. How I talk to all of my patients is really prevention is key. If you're able to help them brush their teeth every day, twice a day, really take care of their teeth so they don't get cavities, that's even better and you don't have to worry about any of that. But it's hard, right? It's not easy. Your child, no matter what age they are, don't always want to let you help them brush their teeth, and things can be very hard. Life gets busy. They're, eating, drinking, maybe they eat a lot of sweets, maybe they're, spending part-time with their mom, part-time with their dad, depending on if they're in the same household. So there's a lot that can definitely happen. And prevention is key if you're able to help it. What I tell my patients too, though, is it's also a very good idea to have them checked by a dentist or a dental hygienist every 6 months. I'm a mobile dental hygienist, which is nice. Patients love it when I can come into their own home. That's what I do. I go into patients' homes to do a dental hygiene exam, to clean their teeth, and children especially love that because the parents don't have to take them to the dental office. The child is more nervous, or sorry, not nervous. They're not nervous. They're more comfortable being in their own home. And it's just kind of easier to do a quick checkup while they're watching TV than to make it a big deal by going to the dental office, having to sit there. They're super nervous. You get the idea, right? So I do let them know every 6 months is key. And I say that because when I'm checking your kid's mouth, I'm counting their teeth, polishing, whatever. I can look for any black spots, brown spots, yellow spots, a lot of plaque, stain. I can look for things that aren't necessarily a good thing, and I can catch things early. I might say, oh, this tooth back here, there's a black spot. It's not a cavity, it's only stain, but that can become a cavity because I can tell with the amount of plaque, with the amount of buildup, that you're not able to brush that area very well. What I'm going to do right now for you to avoid a cavity from starting, instead of just keeping an eye on it, saying like, we'll monitor that, we'll watch it in 6 months, but not really giving the education of why it's there and how to fix it. What I do is I do both. I apply that silver diamine fluoride to kill the cavity right away. It's just a drop of liquid. It's so simple. The patient doesn't even notice it half the time. I can be doing that while I'm polishing at the same time. Plus, I also educate and I say, okay, this is what's happening. I need you to brush those teeth, help your child brush those teeth even better now. I'm going to recommend a different toothpaste that has a high strength sodium fluoride in there. I might even suggest a mouthwash depending on the age of the child. And I want to check back in 6 months to make sure that little spot hasn't gotten bigger. The thing about silver diamine fluoride is it doesn't mean they're never going to get a cavity there. It stops that cavity from growing. But if you're still not brushing properly, another cavity can form on another part of that tooth. So you have to be so, so careful. But this is where silver diamine fluoride really is fantastic because, especially in young kids, catching a cavity early on is so important to prevent those longer dental visits, those, big composite fillings that they have to have, in some cases, stainless steel crowns if the cavities are so big, eating away at most of their tooth, that most of the tooth is gone, but you need to protect that tooth before the permanent tooth comes in. There's such a thing called stainless steel crowns on primary teeth. But all of that can be prevented with proper oral hygiene care. Brushing twice a day, drinking lots of water. The parents definitely have to help the kids, and just limiting sugar and sweets. I know it's hard, but this is where cavities come from. Sugars, sweets, sugar can really get in there. If they're not eating those things, it's a lot harder to get cavities. Cavities can still form, but if there's no sugar, technically they can't form, right? So, something to think about. And it's great to be educated because a lot of parents might think, oh, well, the baby teeth are no big deal. I'm not going to worry about them as much as the permanent teeth. But then other parents might also think, oh my goodness, like we can't get any cavities because I'm going to have to put my child to sleep to fix the cavities. Well, you don't have to. If we can catch them early enough and fix them with the silver diamine fluoride, they might not even need a filling. But again, let's just say that patient has cavities and they're 4 years old. We might want to wait anyway because they're about to lose those teeth. So there's no point putting them through a filling, a procedure if they're going to lose the teeth anyway. But we don't want those cavities to continue rotting through the teeth, potentially causing pain in your poor child. Because in children, their pulp, the nerve of the tooth, is actually bigger than when you're an adult, and it kind of covers most of the area. There's a very thin layer of enamel over top. Whereas in adults, we have kind of a normal size pulp and a lot of enamel, tooth covering it. So when we get a cavity, it does take time for it to get bigger and then even go to the nerve if we're not paying attention. But in children, it could take a day. It could take a week for that little cavity to get very, very big and cause pain or go into the nerve. So something to think about, right? So we like to see kids every 6 months just to monitor. The earlier we catch things, the better because we can prevent it or even fix it before they need to go through any procedures, such as a filling or putting them to sleep or anything like that. So, and we also say we like to see your child as soon as they get their first tooth. You might be thinking they're super tiny, they're just a baby. Why would you see them now? We look for tongue ties, lip ties. We look to see how that one tooth is coming in. We look to see, is there any buildup happening? Like maybe you're not able to use a cloth to clean the gums. We can help you with that. If they're still let's say breastfeeding or using the bottle, they might not have a lot of teeth yet, but you still have to kind of be careful inside the mouth to make sure that that milk or anything else isn't just sitting there, because that can cause problems too. So we look at everything. So definitely talk to your dentist or dental hygienist. We can absolutely help you. But believe it or not, we do look at everything inside the mouth, the lips, the tongues, cheeks, everything, just to see how the teeth are coming together, see how the mouth is starting to form. So the younger we can see them, the better. And consistency is key. Every 6 months is great so we can catch things before they get any worse. So comment below. Let me know if you have any questions, and thank you for watching.